Alabama.
Welcome back. March is National Colorectal Cancer Awareness Month, and today's Ask the Doctor segment is all about colon cancer screenings. Dr. Rajat Parikh from Brookwood Medical Center is here to answer your questions, so you can call us 741-9272. Thanks for being with us today.
Thanks for having me, as always.
Well, I believe we have Greg from Pelham on the line, so we'll go ahead and get to his call. Greg, good afternoon.
Good afternoon.
What is your question for the doctor?
Hey, Doctor. How often do I need to get the buttocks checked?
Was the question how often?
Can you repeat the question?
Yeah.
Well, usually if there's no significant family history or symptoms, we recommend starting colonoscopy screenings at age 50. And then that can be repeated every 5 to 10 years based on whether or not you have polyps or family history. It is very important that we don't wait till 50 on everybody to do colon cancer screening, because if there is a family history or some symptoms such as bleeding, worsening constipation, lower abdominal pain, or anemia, we don't want to wait till it becomes a problem. We definitely want to intervene early. So starting at age 50, if you're pretty healthy and no family history, and you can certainly ask your primary care doc when the best time is for you.
And I want to reiterate that Greg's question was when you should start getting screenings without that family history. So we appreciate your question, Greg. Thank you so much. Do we have anyone else on the line? I'm going to ask our producer real quick if we... Okay, we don't have a call yet, so the phone lines are open. If you do have a call, 741-9272. So we were talking a little bit in the commercial break before the segment. What causes colon cancer?
So colon cancer, and just like a lot of other cancers, there is a genetic mutation that occurs. Our body has a lot of turnover of the lining of the colon, which are built up of cells. And if there's a little gene that goes a little haywire, usually our body does a great job of clearing the bad cells. But if one of these bad cells or mutated cells continues to grow, it will become a tumor, which is commonly known as a polyp in the colon, which we hear about all the time. And these polyps, if we let them grow over 10 or 15 years, will become cancerous. If we can catch them early, we can prevent colon cancer with a colonoscopy.
You said it's pretty preventable. Colon cancer is pretty preventable.
Yes. Colon cancer, was probably about 1 in 18, 1 in 19 people. It's, like we were talking about, second leading cause of cancer death in the country. We've been seeing drops in these numbers as we've instituted better screening guidelines and getting people to get screened through various ways. Colonoscopy is still the best way. There are some other stool tests that can be helpful in diagnosing people at a high risk. We still have a lot of room for improvement, though. We do screen about 60 to 70%, somewhere in that range in the country and in Alabama, but we'd like to get closer to that 100% range.
Does diet affect our chances of getting colon cancer?
Yeah, well, there's no firm one-to-one risk that we've noted yet. There's a lot of research being done. There are some ties to morbid obesity that we have been seeing. Tobacco, of course, not really diet, but it's something that we do to ourselves. But morbid obesity is something that can be a risk, and we do want to address. It may eventually become a factor for earlier screening. Currently we don't tell people to do it 5 or 10 years earlier because of obesity, but that may be down the road as we do more research.
How are Alabamians about getting screened? Are we good, bad? Where do we fall?
We were bad 10, 15, 20 years ago, and we've done a lot better. There's been a lot of initiatives out there with the help of primary care doctors and different health councils and American College of Gastroenterology and the GIs around the state in getting more and more people screened. Like I said, we're about close to national averages now, but there's a lot of room for improvement. Colonoscopy is not the only way to get screened for colon cancer. There are some other techniques, or if that's something that for some reason you're unwilling to undergo or maybe medically not advised due to a lot of surgeries or some other issues, there are some other techniques, but colonoscopy is certainly still the first line choice.
All right. Now, we did have a caller. They didn't want to ask their question on air, but they said they recently had a colonoscopy and now are having trouble going to the bathroom. What can they do about that? And is that common? We're on call quite a bit, and that is a question that we get frequently directly after a colonoscopy. It shouldn't really linger much beyond a few days beyond a colonoscopy. But sometimes the medication we use to sedate people during colonoscopy, just to keep them comfortable, can cause some temporary constipation issues. The significant change in their diet and then reinitiating food sometimes just take a couple days to really have a good bowel movement. But a lot of it is med-related with anesthesia that we use. We're seeing less and less side effects with the help of anesthesia and using something called MAC sedation, where we use propofol.
Okay.
And it has been much better for patients with less side effects.
So maybe contact the doctor after a few days if they can't.
I would, yeah. And it's always safe to take a little bit of something called Miralax without much difficulty. But beyond that, I wouldn't take anything else, because there can be some complications, even from over-the-counter stool softeners. You have to be careful.
All right. Well, we appreciate you being with us today. Thank you so much.
Thank you.
All right. Stay